Hi everybody, I am Britt Talley Daniel MD, a neurologist and headache doctor, and today I'll be talking about do Timoptic or Timolol, the generic name, eye drops work for acute migraine therapy, and I'll be referring to the drug as Timolol throughout the talk. Well, all persons with migraine need to adjust their lives to live with such a chronic disease. It's not their fault. If they have it, migraine is genetic and clusters in families. 20% of persons with migraine have chronic migraine and they're disabled. Migraine is a frequent reason for missing school or missing work, and it's a common reason to go to the emergency room. The most successful acute treatment for migraine attack is still 6 milligrams subcutaneous sumatriptan, which acts within 10 minutes and requires an injection with a needle. A class called triptans are the best treatment for acute therapy still, and there are 7 triptans. There comes a pill also, which take about 30 minutes to work, and nasal sprays which work at 10 minutes but give low levels of the medicine in the brain. The incidence of chronic migraine in the world is 3 to 4%, and 90% of chronic migraine patients have medication overuse headache. The medication overuse headache is 80 to 90% of new visits to a headache clinic. So if you do headache, that's what you're going to see all day long as a new patient. Commonly used headache therapy for migraine involves that's non-steroidal anti-inflammatory drugs like Aleve or Advil, caffeine drugs like Excedrin, and doctor prescription drugs like the triptans. Narcotics like hydrocodone and butalbital are class 4 narcotics and have no place in the acute therapy of migraine because they cause headache for many persons. Dihydroergotamine, known as DHE, can be used IV or intramuscularly, or has a nasal spray also under doctor's prescription. DHE is helpful for headache, and if you're having medication-induced headache, it won't cause it. It will help you get out of it. Therefore, with all these problems, many migraineurs are left with their chronic headaches and limited therapeutic choices. However, many migraine patients find quick relief with Timolol, a beta blocker eye drop. So the question is, do Timolol eye drops work for acute migraine therapy? Timolol works well for acute migraine therapy. It doesn't cause or aggravate medication-induced headache, although the FDA indication for the drug is to treat glaucoma. Timolol also has a separate use for acute migraine therapy. Okay, well, what's the dose of Timolol? The dose for treating is 0.25 or 0.5% solution as a drop in both eyes at onset of the headache, which may be repeated every 1 to 2 hours, and there's no adjusting the dose for renal impairment. Well, aren't beta blockers like propranolol or atenolol used for migraine prevention? Yes, they are oral pills that have a long history for the use of migraine prevention, but they don't work for acute therapy for migraine. Well, what are the side effects of using Timolol? Really not many, and it's well received in my experience. The listed side effects are hypersensitivity to the drug or class, asthma, bronchial asthma, chronic obstructive pulmonary disease, that's called COPD, severe heart failure, uncompensated, second or third degree heart block, AV block, sinus bradycardia, means a slow heart rate, and cardiogenic shock. You have to caution for bronchospastic disease after major surgery, having diabetes mellitus, hyperthyroidism, myasthenia gravis, glaucoma, angle closure glaucoma, and if there's a history of an anaphylactic reaction, you shouldn't use it. What are the drug interactions for it? It works against a CP2D6 substrate, causing bradycardia and low blood pressure. The safety and monitoring of the drug. Well, no routine tests are recommended. Pregnancy, you may use it during pregnancy. Lactation, it may be used while breastfeeding. The pharmacology. Timolol is non-selectively antagonizes beta-1 and beta-2 adrenergic receptors. How about some literature articles? The first one I've got here is from Miglazio and Hagen. They wrote an article entitled Beta Block Your Eye Drops for Treatment of Acute Migraine in the Missouri Medical Journal in 2014. Their take-home message was, a small case series of patients has shown that the use of beta blocker drugs may be a simple and inexpensive way to eliminate pain in patients with acute migraine. They stated, millions of patients suffer from migraines, and the physicians historically have gone through Herculean efforts to find pain relief, but interestingly, an inexpensive and effective drug may literally be sitting on the shelf and waiting to be used in clinical trials. Beta blocker eye drops used to treat glaucoma had been shown in several series of patients to provide almost complete pain relief from acute migraine over years of use, and it's at very low cost to the patients. An ophthalmologist in private practice has been focused on investigations into the usefulness of this therapy for acute migraine for years. Both investigators, with his partner, Dr. Hagen, noted that while daily oral beta blockers such as Timolol, Betaxolol, metoprolol, and propranolol have been used routinely to prevent chronic migraines, they did not stop acute onset migraines after the onset of symptoms. So how do these drugs work? How does it work? Its mechanism. The mechanism of the action of the drops, the authors believe, is the passage of the beta blockers into the nasal cavity and their rapid absorption into the blood vessels. Within a few minutes, the blood level of the beta blockers increased sufficiently to stop the escalating migraine headaches, Dr. Higgins said. This action would explain the success of the beta blocking eye drop and the failure of oral medications, as delivery through the eyes is much quicker than through the GI tract. In some of their most recent published work, the investigators evaluated the effects of Timolol 0.25 and 0.5% in several women who used the eye drops when they first experienced migraine symptoms. According to Dr. Hagen, the women used these treatments over years, and the patients reported nearly complete pain relief and few adverse effects. They got a case story I want to tell you about. A 38-year-old woman had had migraines for 25 years. Her acute episodes were characterized by right-sided headache, nausea, vomiting, light and sound sensitivity, and confusion. Untreated migrainous episode lasted 24 hours or longer. Relief sought with several oral treatments brought symptoms relieved after several hours. She began instilling 1 drop of topical Timolol, 0.25 ophthalmic solution, in both eyes with the first migraine symptoms, with symptom relief after 10 to 20 minutes. On a scale of 1 to 10, the patient rated her relief as 8. She reported slight shortness of breath with bilateral instillation of the drug, and so now she uses 1 drop in one eye with no adverse effect. So she dropped her dose. Another case, a 57-year-old woman who began having migraines at age 5 complained of visual aura, unilateral headaches, nausea, vomiting, photophobia, and confusion as her typical symptoms. Her migrainous episodes began with a visual aura lasting 10 to 20 minutes, followed by severe pain above the right eye. The migraines usually lasted 4 to 6 hours, followed by a feeling of a hangover for 1 to 2 days. Very typical migraine story. About 27 years ago, she started using Timolol, 0.5% ophthalmic solution, sublingually, it means under the tongue when the hour began, and improvement began in about 10 minutes, and in 30-45 minutes, the symptoms were completely relieved. She also had asthma, but use of Timolol did not aggravate her breathing problems. In her mid to late 40s, she was able to discontinue use of Timolol when her migraines stopped. The investigators noted that not all patients with migraines are candidates for this treatment if they have asthma, other breathing problems, and some eye problems. The authors also stressed these patients taking beta blocker eye drops for acute migraine therapy should be monitored closely. Dr. Hagen noted that while this study had only 7 patients, if the results could be replicated in larger placebo-controlled studies, this treatment approach could be beneficial worldwide. Roadblocks. Dr. Hogan emphasized that beta blockers have been reported to successfully eliminate the pain of migraine over the last 35 years. The first reports appeared in 1980 and were followed by others, but to date no large clinical trials have been conducted. Dr. Hagen blazes on the fact that the drugs are available generically, which will provide little profit for the pharmaceutical industry to explore this treatment with a study. He emphasized that prospective mask-controlled, randomized clinical trials are long overdue, and they could prove or disprove whether beta blocker drops are useful for treating migraine, even chronic migraines. Okay, I got another article here from Ryan Cady, Kent Drexter, and Roger Cady of the Headache Care Center in Springville, Missouri. They're famous migraine investigators. This name of the article was Use of Beta Blocker Ophthalmic Solution for the Treatment of Migraine. It was originally published by the National Headache Foundation. So that's a big deal. In the Annals of Migraine, one of the most fascinating stories is how, in 1966, a physician named Robert Rabkin observed that the drug propranolol could prevent migraine. Dr. Rabkin was actually conducting a study using a beta blocker, propranolol, to treat heart pain, which is called angina, chest pain, and fortuitously observed that one of his research subjects had a remarkable reduction in the frequency of her migraine attacks. A decade later, Dr. Seymour Diamond, very famous, along with John Graham, very famous headache doctors, presented their experience treating 86 migraine patients with daily propranolol to the FDA and demonstrated that propranolol was indeed efficacious and safe for migraine prophylactic therapy. That means preventive therapy. You take it every day. Subsequently, propranolol became the first FDA-approved medication for the prevention of migraine. Dun, dun, dun. As one of the many beta blockers used commonly to prevent migraine, propranolol currently is probably the most widely prescribed medication in the world for prevention of migraine. Beta blockers are used to treat multiple diseases, including high blood pressure, heart pain, and irregularities of the heart, as well as conditions such as anxiety and certain types of tremors. Beta blockers have been so successful they're considered one of the most important medical discoveries of the 20th century. In 1978, a second beta blocker, Timolol, also received FDA approval as the first topical beta blocker for the treatment of glaucoma. Although clinical trials demonstrated a very strong benefit for using Timolol as a migraine preventative, neither it nor propranolol had demonstrated efficacy as an acute treatment for migraine. However, these previous studies have focused on oral preparations of drugs, and the drug was not absorbed quickly enough to be used for acute treatment strategy. So, two ophthalmologists, Dr. Hagen and Dr. Maglazzo, recently made their report, which I just went over earlier, about using Timolol eye drops for treating migraine. The 7 patients in their case reports were all females who presented with migraine symptoms with and without R. 5 of the 7 patients reported complete pain relief, and 1 patient reporting complete relief within 10 minutes of treatment. That's really good. The 2 remaining patients reported pain relief on an 8 and 9.5 of a 1 to 10 scale. These patients were all instructed to use 1 to 2 drops of the beta blocker eye drops as early as possible during their acute migraine attacks. Patients were advised to blink several times to encourage the eye drop to pass into the lacrimal drainage duct. And interesting, 1 patient used Timolol drops sublingually and reported receiving pain relief. The eye drops were generally well tolerated, with only 1 reported side effect of shortness of breath, which only occurred if the eye drops were used in both eyes. So how would these beta blockers work in acute treatment of migraine? The exact mechanism in the treatment of prevention of migraine is unknown, but beta blockers work primarily by blocking the stimulating or activating effects of adrenaline. Consider that individuals with migraine have inherited a nervous system that's more excitable than those without migraine. It's easy to assume that beta blockers may in some way reduce this inherent excitability. In other words, the beta blockers may make the nervous system less vulnerable to migraine. While this likely explains the migraine prevention benefits, it also may provide a rationale for their use in acute treatment of migraine headache. One can imagine that during a migraine, the threshold of the nervous system activation has already been surpassed, and hence the process of migraine occurs, but beta blocker eye drops enter the nasal cavity through the lacrimal duct, a small passageway from the eye to the nose that drains tears very quickly. Once in the nose, the eye drops are rapidly absorbed into the bloodstream. conceivably they could block the activating effects of adrenaline and allow the nervous system to reverse migraine. Beyond the speed of entry into the blood, another major advantage of nasal absorption is that medications do not have to pass through the liver before entering the systemic circulation, thus avoiding their metabolism by the liver and allowing a smaller dose of medication to be effective. Beta blockers have also been used to reduce the electrical excitability of nerve cells, as this too may be part of their potential mechanism. So I'm going to complete this talk at that point here. Please click subscribe down there so we can follow each other. I have other articles, other YouTube videos on YouTube that you could watch for migraine if you would follow me there. God bless all you folks with migraine, and I will see you all on the next talk.